Hello future parents, for today's video make sure you have a jug of water, possibly with a straw close by, and get as many pillows as you can find in the house because we're gonna do the miles circuit together. Welcome to this channel. If you're new here, my name is Ilenia and I'm a midwife with a passion for education and empowerment during your pregnancy, birth and postpartum journey. If you like motherhood type of content, pregnancy, birth, breastfeeding and everything that falls in between, please make sure to subscribe to the channel to get a video every week. That being said, today we're going to talk about the miles circuit, which is a 3-step circuit developed by 2 doulas in the United States of America that really put together these 3 positions that I'm going to explain you in this video to help a woman whose labor was stalled and seemed not to be progressed in a normal physiological way. So they came together with these 3 positions that have the rationale of scooping baby back up, so higher in the pelvis, in order to let baby then adjust and rotate into a better position. In fact, we know that while mom's job is to dilate, baby's job is to rotate and adjust and navigate into the pelvis in the right position, which is the occipitus anterior position, meaning that the baby's head, the baby's back, is leaning on your belly like an hammock. So their back is in the front, close to your tummy. And they're not giving your back to your back, which is the occipital posterior position, which is the one that we really try to avoid during labor, because occipitus posterior babies, or sunny side up, are babies that usually have very long labor and they have hard time to rotate and to adjust in order to be delivered vaginally. So don't get me wrong, some babies are born occipital posterior and that's very great when it happens, but generally speaking we want baby to get into the anterior position, and we can do so by readjusting, so rebalancing a bit mom's pelvis in order to let baby have more space and have more room to adjust and to engage in the pelvis in the right position. That being said, the circuit is great also when done above 37 weeks if your baby is in the cephalic position. You can start by doing the circuit 10 minutes a day and then extending the length of the circuit up to 90 minutes, which is the length recommended, the time that you need to do the full circuit properly. Because it's great that you get baby in the right position even before labor starts. So you can do this during pregnancy for sure, and also during early labor or prodromal labor, when your labor really seems that it's not evolving, not getting stronger or not getting anywhere, and you've been laboring for days, then it means that your baby just needs an extra hand by you. Or when baby is diagnosed to be, not in the occipital anterior position, these positions are great to give your baby an extra chance to rotate in the occipital anterior position. So let's go into the positions now. Before you start, you want to make sure that you have some water close. Make sure to empty your bladder, go to the toilet before you start, and gather as many pillows as you want. Step 1 consists in adopting the knee to chest position. So starting with a cat-cow position, in all 4, then you want to lower your chest to the ground. So make sure that you are able to relax in this position, maybe put a pillow beneath your knees so that you're more comfortable, or if you want to do this position in the couch is fine as well. Make sure that you have a water to sip close by, because you need to stay in this position for 30 minutes. You want to make sure that the legs are wide open and that the angle between your legs and your torso is wider than 90 degrees. If this position is hard for you to keep for 90 minutes, then you can ask your partner if with a rebozo or a scarf or a piece of long fabric, it helps you to tuck it under your belly and make like a gentle tension, so that you can be helped to maintain this position for 30 minutes and that your lower ligaments are even more stimulated to relax and to let go, because you kind of lean all your weight onto the rebozo. So that's great to do with your partner as well if you're not able to maintain the position for 30 minutes. Step 2 is called the exaggerating left lateral. It's also called the exaggerated runner. So go laying into your bed on left lateral and make sure you tuck your tummy with some pillows, and that you elevated your right leg as high as you can and bring it as up as you can to your face, while you stretch your left leg as well. This really kind of widens the pelvis and, you know, just gets the pelvis into a better position for your baby to scoop up and scoop down into the better position. If you're having contractions, that's great, just stay in the position during the contractions. Same being said for the step 1 and step 3 of the circuit. If you're not having contractions, or if you're having these contractions that are still regular and you're able to fall asleep in this position, that's great. Just take advantage and fall asleep. If you're repeating the circuit later on for other 90 minutes, then make sure you do the right side the second time you try. But for the first time, start with the left lateral. After you got plenty of rest for 30 minutes with the exaggerated runner position, then it's time to get up and move. For the third step of the circuit, you want to make sure that you get the pelvis asymmetrical. So you want to elevate one leg by lounging or putting the leg up into a step, or if it's a nice day outside, you can do the curb walking. Just make sure that one leg is always higher than the other leg, so that your hips are asymmetrical and stay asymmetrical for 30 minutes. You can also do the steps 2 by 2 side lying. Very important that if you're lounging on a stool or on a step, that you keep the 90-degree angle between your thigh and your foot, just so you don't close the pelvis by exaggerating the lounge. That's all. That was the circle. It's very simple, and it gives you just the chance to maybe think about positions that you were not gonna adopt if you didn't know them. And really, if you're watching this video that you are past your due date, that you're 40, 41 weeks, 42 weeks, I feel you. So make sure that you give your best chance to go into labor. If your labor not starting, it's definitely because there is an imbalance in your pelvis and your baby is not able to put himself or herself in the right position. And also mentally, you need to be able to relax and to let go, and this circuit helps you to do both things and to correct a physical imbalance, and also hopefully to able to relax you mentally and be able to let go this pregnancy. If you are watching this video and you are in early labor and you need just a way in order to let your labor progress, then the circuit is great to get a baby that was not engaged in the right position, to hopefully give you the best chance to engage the baby in the better position. Usually labors that have been very, very long in the latent phase, in the prodromal phase, then they go a little bit quicker after. So I really hope you're gonna be one of them. I wish you the best of luck. Make sure to like the video if you liked it and subscribe to the channel, and I'll see you next video. Bye bye.